Hello, Kayla. You're on the air.
Hello. So
Hi.
I had a CAT scan a couple of weeks ago, and they showed that my right heart was enlarged. So I had an echocardiogram, and they showed a possible shunt from the left to the right atrium, as well as a small hole between the two sides.
Mm-hmm. And how old are you?
I'm 24.
Okay. Did you have a heart murmur as a kid?
Not that I'm aware of, no.
Okay. Well, yeah, you went in for examination. They listened to your heart, and it would have been easy to pick up. And, of course, this is not an unusual thing. It's called the foramen ovale. Did he tell you the name of it?
He did not, no. I meet with a cardiologist next week. That was just what they had given me so far.
Yeah. Okay. And this is a congenital birth defect. Mama was missing something when the heart was forming in you as an embryo. And there's supposed to be a hole there to allow, when the heart beats as an embryo, is shunting the blood from the left side back to the right side, so you're not pumping a lot of blood into the lungs, which are, you can't use your lungs when you're an embryo and all that fluid, and that shortens the cycle. But once you're born, usually that hole, because of the pressures on the right and left side and the pressure breathing and everything, that hole will close very quickly. But if it doesn't close, usually you will get a heart murmur, and so it may have been functionally closed until the heart enlarged and then it opened up again. Okay, that's a possibility. And did they talk about anything like congestive heart failure or anything like that?
They said that it could eventually lead to that if it's not fixed.
Okay. Yeah, congestive heart failure, particularly starting out with the right side of the heart, is enlarged. Okay, and that can be caused by deficiency of a single vitamin. How much do you weigh, Kayla?
125 pounds.
Okay. Do you have any other issues like arthritis or high blood pressure, diabetes, or anything like that?
My blood pressure has been elevated over the last 6 months or so.
Okay. Okay, very good. Thank you. Okay, this is a Shar thing. Shar, how would you help Kayla with her enlarged heart? She's got because the heart's enlarged, the foramen ovale, that little hole is open, and I believe it was functionally closed for 20-plus years because it's not going to open if it was closed appropriately at birth. And so I think it was functionally closed because it had the pressure, but it never healed closed, so that it was as soon as the heart enlarged, it opened up again. And so what would you do to make her heart happy and deal with the high blood pressure?
I give her the Healthy Brain and Heart Pack, and then I'd give her the De-Stress, and I would give her the Ultimate Daily Classic and the Niacin Plus and the Cardio Sticks.
Perfect. Very good. Okay. Well, certainly you got to get rid of the bad stuff. In your case, it would be the basics: no fried foods, no processed meats with nitrates and nitrites, no oils whatsoever. Certainly no gluten, no wheat, butter, and oats. And you also need to avoid sugar because the one vitamin that's missing when you have congestive heart failure is very sensitive to sugar. It makes the deficiencies worse. Okay? And so you got to avoid sugar. Anything you're going to get from fruit and fruit juices, as far as nutrients, you'll get from vegetables without the risk of the sugar. So you can kind of go that direction. Char's exactly right. I would go ahead and take one Healthy Brain and Heart Pack per month, get an extra bottle of selenium, so you can take 6 of those a day, 2 at breakfast, 2 at lunch, 2 at dinner, and then divide all the other products up in the Healthy Brain and Heart Pack and take a half a dose of everything twice a day, except for the EFA Pluses. You could take 3 of those for breakfast, and the EFAs, you could take 3 of those at dinner time. That'll work out properly. And then she's quite correct. Char's quite correct. I'd have you take 3 of the De-Stress capsule. It's capital D like David, dash stress. I'd have you take 3 of those twice a day. That's 2 bottles a month. That's specifically to support the metabolism of the heart muscle, to support and promote healthy function of the heart if you do have congestive heart failure. And for the high blood pressure, Char is exactly correct. I would go ahead and throw in the Ultimate Daily Classic tablets, 3 of those. And since you do have a pathology there, I would go ahead and take 3 twice a day. That's 2 bottles a month. If it's a financial problem, just take 1 bottle a month and separate them out, 1 at breakfast, 1 at lunch, 1 at dinner time. But if finances are not a problem, you take 3 twice a day and 2 bottles a month. And then again, if finances are not a problem, I'd go ahead and add 1 of the Ultimate Cardio Sticks. whip it up and take a half of the dose at breakfast, put it in the refrigerator, shake it up real good so you make sure it's suspended properly, and take the second half at dinner time. And then I would also take one of the Ultimate Niacin Plus at breakfast and one at dinner time. That'll be 1 bottle a month. And give us a call every couple of weeks. Give us a call anytime you visit the doctor and get some kind of assessment. But in Oregon or on the West Coast, it'll take a couple of working days to get the product up to you, but you can start the diet immediately, which that alone is going to help support healthy heart function in this case. And so do keep in touch with us, because I believe this is all resolvable. And I think you're going to be amazed at how well you're going to do.